Let's welcome Debbie Lambert and Belinda Phillips of Novant Health Women's Services. Welcome, Debbie and Belinda. What a pleasure to have you guys here.
Thank you.
Thank you.
So I like to start the interviews by learning about my guests. So that's where we're going to start today. So Belinda, I'm going to start with you. So tell me a little bit about your role at the hospital and where you went to school.
I attended school in Stanley County at the Stanley Community College. Is where I got my nursing. I just finished my Bachelor of Science in Nursing a couple years ago through Chamberlain University. I have been a nurse for 20 years. Was the breastfeeding coordinator in Stanley County at their health department for several years. And after moving down here, working at this hospital as an RN, our administration saw the need for lactation here at the hospital. So I moved into that role and have been enjoying that for about 3.5 years now.
Great, that's awesome. And Debbie, how about you? What is your role at the hospital and about your education?
Okay, I'm the nurse manager for the Women's Center, and my background in education is master's in nursing, and I received that in 2010 from Regis University in healthcare management. And my healthcare experience, I've had 34 years of healthcare and about 23 years of nursing.
Debbie, I understand that you have some really good news to share with our viewers today, right?
I do, yes.
And what is that?
We recently received our baby-friendly designation.
And tell me what baby-friendly means.
It means that our hospital now is, we provide a lot of information and education that is helpful in our moms being successful with breastfeeding their infants.
Wow, that's hard. Did you have to go through like a survey or something?
Yes, that is an amazing, comprehensive process for hospitals to go through, getting their baby-friendly designation. What we start out with is the administration backs us, and we send in a letter requesting to begin the pathway to baby-friendly designation. And throughout this pathway, one of the big steps is education for our staff. That includes not only the nurses, but the physicians, ancillary staff. We go through a lot of education to learn about the 10 steps to successful breastfeeding. So these steps give us a guideline to go by for our mothers and families here at the hospital to assure them that they will have a successful breastfeeding experience here at the hospital. So after we've done the education with the staff, we are also educating our patients, our families, our mothers as they come in. And this begins as soon as they come in for their OBGYN visits. So as they enter for their maternity visit, they're getting breastfeeding education from the very beginning, which runs through their entire pregnancy, follows them into the hospital, and gives them a successful experience there.
So the benefit then to patients is the ability to know what to expect, is that right?
Absolutely, absolutely. And as they're going through expectations for the hospital, for their experience, part of the 10 steps is we begin with the skin-to-skin contact. So right after this baby's born, we place the baby right there on mom's chest. So that's enabling that baby to regulate their temperature, their blood pressure, their heart rate, breathing.
I wondered what that was for.
Yes, even those blood sugar levels. We like them to stay there on mom with that skin to skin until they've completed that first breastfeed. And that is actually for all our babies, no matter how they're being fed. We like that skin to skin. Also, another thing that our moms can expect is rooming in. The babies stay in the same room with these moms the entire time they're at the hospital. We do the baths in the room. We're doing some of the procedures like the hearing checks and things like that in the rooms. Lab tests can be done in the room. So there's very few reasons that we would need to take a baby out of the room. And that gives them the opportunity to learn how to care for this baby. So as they're caring for this baby, they're becoming more comfortable and more confident to take this baby home.
And so that's all part of becoming baby friendly, right?
Yes, it's all part of those 10 steps to successful breastfeeding. Absolutely.
So they're all sort of intertwined. They're all,
yes,
it all goes together. Yeah, I wasn't sure about the baby-friendly designation. I didn't know if that applied to like guests visiting, people visiting the hospital, or if it was all about the patient and the deliveries. So
yes. Yeah, it kind of applies to everyone, because as you're learning about what is healthiest for the baby, the families kind of learn also that we need to give them that time to be skin to skin, that we need to give the moms the ability to feed their babies when they see those hunger cues. And yes, because the family members are around, depends on the comfort of the mother. So we want, you know, as we're giving education, then we can speak to families and say, well, this baby is hungry. See what they're doing?
Well, it seems like there are a lot more babies being born at Novant Health. Debbie, can you talk to me a little bit about that?
So we had a little record breaker last year for 2017. We went over our 500 goal to 516.
Wow,
Yes.
that's a lot.
Lots
Especially for this county. You know, we think of it as a retirement area, but those babies are coming from somewhere.
That's absolutely correct, yes.
That's awesome news. Since we're talking about babies, can you remind me about the OBGYN practice, who those physicians are?
So we have 4 practicing physicians there at the hospital, Dr. Bodenheimer, Dr. Shue, Dr. Thompson, and Dr. Toller. We also have a nurse practitioner, Sarah. They are there, and they are quite busy.
That's a great group. We've had them on the show, and they just do a wonderful job. But before we wrap up, is there anything else that you guys would like to add?
We would just like to encourage our families in Brunswick County to come see us here at Novant Health. Our experts are ready to help them give their babies a remarkable start.
Oh, that's sweet. What about classes? Do you do childbirth classes?
Yes, we're doing breastfeeding classes and childbirth classes. The breastfeeding classes are the 3rd Tuesday of each month at 5:30 p.m. They can call the office to register. Our childbirth classes are the 2nd Tuesday and Wednesday of each month, and they can also register at the office.
Great. Well, Debbie and Belinda, it's been a pleasure having you. I've learned a lot of new stuff today about being baby friendly. So I hope you'll come back and visit with us again.
Sure, absolutely.
Thank you.
Thank you.
Nice to be here.
Great.